My name is Roberta Hales. I'm actually the simulation educator for the Center for Simulation and Advanced Education at the Children's Hospital of Philadelphia. Our lab has been up and running for the past 7 years. I was there from the beginning of it. And we are specializing in pediatrics in doing in situ simulation. We basically do not have a simulation lab, so we go to them and run all of our simulations in the clinical area. I think for the clinicians, it really helps increase the reality of the simulation because they can actually use their tools and equipment in the simulation instead of having to come to a simulation environment that might not be as real. So I've been involved with simulation for 7 years. I have been designing the simulation at our hospital from the curriculum development, planning, needs assessments, all the way through to implementing multiple programs. We currently have 130 active programs of simulation that are all based in situ, and there are probably 50 more programs in the development at the moment. But my background actually, coming into simulation, I love to do education. I did a lot of education of residents, fellows, attendings, nurses, prior to me coming over to simulation. So it was a vested interest of, one, I wanted to do something different, and two, simulation seemed the avenue to go to help achieve my personal goals was to make care safer for patients. For me, in where I am at right now in my career, coming to a SUN actually, for me, is good for networking. So I can talk with other people that are doing simulation, listen to what their ideas are, listen to what they're doing, and see how maybe we can work together in doing something. But it's really, for me, it's all about networking. The lectures are wonderful, and the lectures that I've heard about, unfortunately I have not been able to see any. The lectures I've heard so far have been awesome, but most of the lectures are ones that I've already probably have seen. So to me, it's more about networking. I was asked to come up and present a presentation on improving the care of a pediatric patient. And my presentation really focused on starting about why are pediatrics unique, what are some of the issues and problems that are happening out there, what are the strategies that are being used in institutions in improving patient safety. And then from there, I focused into how simulation can help. And so I talked about all the different programs that we have running in our institution to help make care safer. And then I talked about the simulation process of how you develop a curriculum when somebody comes and knocks on your door and says that I want to use simulation. So I went through and taught them our curriculum process.